Welcome to Pod Save America. I'm John Favreau.
I'm John Lovett.
I'm Tommy Vitor.
On today's pod, I chat with Elizabeth Warren about the fight over the next coronavirus relief bill in Congress. Before that, we'll talk about how Trump's decision to let states fend for themselves and compete with each other when it comes to fighting this pandemic, why we should all be paying attention now to how we're going to vote in November. But first, Lovett, you had a very funny show this weekend with some very funny people. Tell us about it.
We did. We had a great Lovett or Leave It. Kumail Nanjiani and Emily Gordon played the Newlywed Game. We had...
That was very funny. The Newlywed Game was great.
They were so delightful. We had... And also, it was good to finally talk to Kumail about his physical transformation.
No, I found that offensive. I was glad you took him to the woodshed.
You gave him a lot of shit for that. I like it.
Unbelievable.
But he's lost 30%. He's lost 30 pounds of funny, and he hasn't. And then Alex Wagner from our new pod 6 Feet Apart helped me call listeners with their new self-care habits, and Saru Jayaraman came on to talk about the plight of restaurant workers and how we can help them, including through our fund. So it was and we did a live show for Seattle, which was really fun. We talked to like 50 people over Zoom. So it was we're experimenting. Check it out.
Good stuff. As you mentioned, you had Alex Wagner on from Crooked Media's brand new podcast, 6 Feet Apart with Alex Wagner, which everyone should subscribe to if you haven't already. You are missing out. In the first episode, she interviews the CEO of a large food producer who's doing a great job protecting his employees from this pandemic, as well as a crew member at Trader Joe's whose employer is not doing a very good job. It's a fantastic show. You'll learn a lot. You get to hear the very human stories from this pandemic that aren't being covered everywhere else. So check it out. New episodes come out Thursdays. Finally, tune into our Instagram at Crooked Media, where all your favorite Crooked Media pals have been going live to answer your questions and talk about our lives. Right here in the copy, it says, ad lib about your lives.
Here's the thing about ad-libbing about our lives. There's no improv in our lives.
No,
there's no ad lib. There's nothing. Our lives are all the same. We're all having the same life.
Small and sad.
All right. Well, that's why you should tune in. Also, our video team has been churning out some fantastic explainers and other fun stuff on youtube.com/Crooked Media. So go check that out as well. We're spitting out the content here, left and right. All right. So here's where we are. In the span of about 1 month, we've lost over 10,000 Americans to COVID-19, and there are now more than 330,000 confirmed cases of coronavirus in the United States. On Saturday, Donald Trump said, quote, "This will probably be the toughest week between this week and next week. There will be a lot of death, unfortunately." I'm sure his tone was just right when he said that. And even with 90% of the population under orders to stay home, many states are still terrified that their hospitals will quickly become overwhelmed and are really struggling to get protective gear for healthcare workers and ventilators for patients. Let's listen to what Andrew Cuomo had to say about the current process. Tommy, why is this happening?
This is happening because Trump and Jared and his entire team are trying to push responsibility for the response from the federal government into the states. So instead of trying to centralize the purchase and manufacture of these crucial medical supplies, they're telling states basically, you got to figure out how to get this stuff on your own. Don't count on us. But there's just a finite number of suppliers and manufacturers out there. So you have New York competing with California and Illinois and FEMA and foreign entities. And, it's a disaster. And, Cuomo was saying it drives the price of ventilators from $25,000 to $45,000. But for some states, it's even worse than the price. You've seen states saying, when we're about to get shipped an order, the federal government swoops in and takes our order. It happened to Massachusetts. It happened to Kentucky. Charlie Baker, a Republican governor of Massachusetts, said he bought 3 million masks and they were confiscated in New York. So then they had to have the New England Patriots owner fly to China to pick up 1 million more. So it's this ad hocery. What we need is a competent, highly technical manager to nationalize, oversee, and streamline the process. But the federal government won't do it. Gavin Newsom here in California is trying to build a consortium of states to work together to, put their purchasing power together and stop competing. So Cuomo's doing his best. He said, I think 1,000 ventilators are arriving soon from China. Oregon is loaning New York City 140 ventilators in a sign of kindness and decency that we wish was coming from Trump. But it seems like it's going to be this like everyone fend for themselves effort for a while.
Love it. That thing that Tommy just mentioned about Newsom building a consortium of states to buy protective gear in bulk. Like, isn't that what the federal government is for, if nothing else?
Well, I mean, look, I think one of the things you can do is you can kind of form this consortium of states and then maybe have a kind of a set of rules. You kind of have them work together, create a set of rules, like who's in charge of this and who's sort of a federal system. Certain safety balance. You have to have checks and balances, right? Because you don't have too much power to accrue to that kind of consortium. Look, it's horrifying. It's compounding the early mistakes, right? We learned over the weekend that it seems as though the Trump administration did not actively start pursuing purchasing of much needed medical supplies until mid-March. So now they're coming in trying to make up for their own failures. The governors are desperately trying to build up their own capacity because in part the federal government failed. And the end result is the early failures to actually take this seriously are now being compounded by the federal government coming in and competing with the states for resources, driving up the cost of everything and creating a chaotic situation in which, it's not just, Tommy said it's Kentucky, it's Massachusetts, it's Maryland, it's Colorado. All these states are discovering that they're now competing with the federal government when the federal government should be coming in and making sure that every state has what they need when they need it.
It also seems to be that there's some politics driving these decisions. Washington, Illinois, Massachusetts, Maine received a fraction of what they requested from the federal government. Florida got everything they asked for within 3 days. It's not perfectly aligned to Donald Trump's political considerations. Like apparently Georgia couldn't get what it's wanted. New Jersey is getting what it wants. So it doesn't perfectly line up, but it does sort of fit with both incompetence and if you happen to know someone in the White House or you're in a state that Donald Trump needs to win, maybe you get your call answered a little bit quicker.
Yeah, I mean, his staffers are saying on background that like Trump cares a lot about Florida because it's a swing state too. So that kind of helps spell it out.
Well, yeah, and when there's no process, when there's no one really serious running this, and it's all done, as Tommy said, in an like ad hoc way, a well-timed call comes in and gets answered. Another call doesn't get answered. It's all, it's a combination of Trump's sort of venal political necessity plus, it's a combination of Trump's like venal political necessity plus just chaos. Like every story coming out of the White House over the weekend, there's a lot of nefarious purpose. But there's also just incompetent boobs in charge of things they have no business being in charge of.
Speaking of great segue, love it. One place
that's theoretic. I read the outline.
Wow, you know where I'm going. One place that's theoretically supposed to help with the shortage is the Strategic National Stockpile, which manages the country's emergency medical supplies, except it's now almost empty. When asked about this at Friday's briefing, Jared Kushner climbed out of Donald Trump's pocket and said, quote, "The notion of the federal stockpile was it's supposed to be our stockpile. It's not supposed to be state stockpiles that they can then use." This directly contradicted the description of the stockpile on the government's website. So, of course, the White House responded by changing the description on the website to fit Jared's bullshit. Guys, how do we feel now that our lives are in Jared Kushner's tiny hands? Tommy, you want to start?
Long fingers. They're skinny.
What do they call him? They're denigrating him and his buddies as the slim suit crowd or something like that.
Yeah,
I mean,
the slim suit crowd.
Look, Jared Kushner running a pandemic response it's not a joke. It's the worst case response. It's the reason you need anti-nepotism laws. It's the reason they were designed to prevent this situation. And you can tell from these briefings that Jared isn't just this like wayfish little idiot who's in over his head. He's actually like an actively vindictive little guy. He takes the same tone rebuking governors that he doesn't like that Trump did. And frankly, like he was just as arrogant and dismissive during the Middle East peace discussions. And like, just a quick aside, like the way Jared is very dumb is if you told me, hey, here's a giant like catastrophic problem, you could either take 20 representatives from these big companies or harness the power of the federal government, which fighter do you choose? And the answer is obviously the federal government when you consider like the capacity the military alone has. But instead he's like bringing in like a UPS representative to his office for some reason. So whatever. But like, look, this is a problem. Like Lovett was just saying, the AP did this big survey to figure out when federal agencies started this bulk purchasing. So we're now way behind on N95 masks, which are hard to make and often produced overseas. And you have a scenario where like the hospitals are running out, the stockpile is about to run out. No one is really asking the question, then what? Because it is such a frightening answer.
Lovett, what do you think about Jared? Who's I mean, it's not just anti-nepotism laws. It's like anti-dipshit law. It's like the guy is just, even if he wasn't related to the president, he was still, it's like he's so unbelievably unqualified. He has failed at everything he's done in his life except marrying into a wealthy family.
Yeah, I mean, look, he's no success. He's never succeeded. You can't say, like, what's Jared's biggest accomplishment? There's none. But he's been kind of socially passed throughout his life because of money. He bought a spot in Harvard, goes into real estate, buys a building on Fifth Avenue, blows that. Obviously, Middle East peace has not been resolved. And now he's in charge of this. And it very much is like Jared Kushner has been in the little baby seat with the wheel his whole life. His whole life, he's been driving just in a little car, in the passenger seat, driving his little wheel while the real person was driving the whole time. And now he's supposed to be driving and he has absolutely no idea how to drive. He has no idea what he's doing. There was in the Washington Post piece, there's a long story, yet another kind of, what would you call it? What's it called
TikTok?
when you open up a corpse? What do you do it? What's it called? What do you do? It's come on, autopsy. It's an autopsy.
Oh, okay. There you go.
This is what it said in the piece. Right now, Fauci is trying to roll out the most ambitious clinical trial ever implemented to hasten the development of vaccines, said a former senior administration official in frequent touch with former colleagues. By the way, I have a guess at who this is. And yet, the nation's top health officials are getting calls from the White House or Jared's team asking, wouldn't it be nice to do this with Oracle? And so you have like this little band of dummies talking to corporations, doing like what they did when they went to Davos and went to Bilderberg and trying to Bilderberg the fucking coronavirus while the real professionals are stuck batting back fake cures that haven't been proven yet and whatever shit Rudy Giuliani is saying in Fox News and whatever Dr. Drew is up to. And, it's not just that they're not successfully making a response. It's that Jared Kushner is actively hurting our country's ability to help people.
It's Bilderberg like global elites thinking they can solve problems combined with Silicon Valley arrogance / naivete that we're gonna hack the coronavirus. We're gonna hack poverty. It's like, you are fucking morons. We need a grinding, like logistical, organized effort. This isn't a hack.
Well, he's been installing his people in different agencies, and whoever at FEMA described it as a frat party that descended from a UFO and invaded the federal government is just, that is 100% right there.
Creative.
Nailed it. So, Trump isn't just leaving states to fend for themselves when it comes to medical equipment, but also when it comes to issuing stay-at-home orders. There are still 8 states that haven't, all of them red, all of them run by Republicans: North Dakota, South Dakota, Iowa, Nebraska, South Carolina, Utah, Arkansas, and Wyoming. This is after Dr. Fauci said we should have a national stay-at-home order, to which Iowa Governor Kim Reynolds responded, quote, maybe Fauci doesn't have all the information about what states like hers are doing to slow the virus. Why has this been left to the states, and why is this so dangerous?
So 2 guesses. I mean, first, it's a lot easier, right? I mean, managing a huge problem like this, all the complex needs of individual states and the components of the government, it's very hard. And this is a massive, unprecedented challenge that requires competent people, and Trump has fired all of them in lieu of hiring those who tweeted MAGA at a certain date and time because they passed loyalty tests. And what we know about the core of Donald Trump is that he wants credit for everything without taking responsibility for anything. And so he's pushing it off into the states. There's also, though, a deep-seated belief in some Republican ideologues that you want a weak federal government, that states should somehow be in charge of most things, if not everything. There's the libertarian, don't tread on me, strain of republicanism. And both of those perspectives, Trump's lack of responsibility and the laissez-faire, don't tread on me government perspective, are running headfirst into the reality that public health infrastructure in this country has been underfunded on a federal level and in many cases gutted at a local level, and it's a recipe for a very bad outcome.
Yeah, love it.
I mean, look, it mirrors what happened with the Medicaid expansion. In that, like, I actually don't have a problem with the fact that the president not dictating a nationwide stay at home. I'm actually like pretty comfortable with the idea that the president could say to the country, I'm urging every governor in the country to issue a stay at home order. Because what we haven't seen is Donald Trump actually direct a policy that made it clear to those states that they should stay at home. In fact, when DeSantis was dallying and delaying, dallying?
I liked it.
Dilly-dallying?
Yes.
Dithering.
When DeSantis, when DeSantis was dithering, delaying, dilly-dallying.
Dicking around.
Damn it.
Dicking around. Mike Pence is in the briefing room calling him decisive, and Trump refuses to criticize him. You know, the same Republicans who said we need to let the states do what they will with healthcare have consigned millions upon millions of people in Southern American states, particularly Black, poor Americans, to not have healthcare because we gave states the choice and then states didn't act on it. So, you know, I don't know what it looks like if Donald Trump had been an actual leader early on. If states that hadn't yet done a shutdown would have done it despite it not being dictated by the federal government. But we'll never know because the response was so mismanaged. That's all.
Yeah, I mean, 2 points on this. One, you hear a lot of these governors, when asked about why they haven't issued stay-at-home orders, their excuse is, well, I haven't heard anything from the federal government to do that. I haven't heard the president say this. So it is that they are looking to Washington and to the president for leadership on this, or at the very least, using him as an excuse for doing what they want to do anyway. Second, the reason why this is so dangerous, first of all, it's tragic for the people in these states who are now going to experience higher rates of infection because the virus will be allowed to spread in these states because people aren't staying at home. It also affects the rest of us, which is why it should be national. We have been home. We have been under a stay-at-home order since March 21st here in California. We are now going to have to stay at home longer and probably extend these social distancing guidelines because there are going to be states like Florida and states like Georgia and states like the 8 or 9 that I just mentioned that still don't have stay-at-home orders where the virus runs wild. And what's going to happen in those states, those people in those states are going to travel to other states. And it's, you know, just as we keep infections down here in California because we all stayed home since March 21st. Well, what's going to stop all the people from the other states where they don't have stay-at-home orders to start coming to California and getting and causing outbreaks again? I mean, this is why you can't have a fucking state-by-state response to a national pandemic, a global pandemic.
What pisses me off is sorry.
No, you go.
What frustrates me so much about this is Trump has so much political leeway to do the right thing here. If Barack Obama were president and he called for a national shelter-in-place order, you would have like Greg Abbott down in Texas saying the government was going to come take your guns away. You know, like all the fever dream bullshit they did to him then. Trump and the MAGA cult has the political ability and space to say, hey, we really need to do this. This isn't just owning the libs. We all do need to stay home because the key to social distancing is to do it before the numbers explode. And all these governors are too cowardly and they're saying, well, we haven't seen a big explosion of cases here in Iowa yet. I don't know what Dr. Fauci is looking at. And the reason is just time. Like you're going to see a big explosion of cases if you don't do the right thing. And that's why I find this so frustrating.
It's also, you know, Scott Gottlieb, the former FDA commissioner, has been talking about this. Like, it's also runs counter to their economic goals, right? Like, okay, they don't care enough about, they're too cowardly to care enough about the health of their own people. Fine. They're just worried about their economic conditions going into November or going forward. Fine. If you don't do what you need to do to contain the virus when we're all staying at home, or when 90% of the country is staying at home.
Yeah.
And then we start to come out and the disease is coming back and you can't trust that it's safe. You will not see the recovery. You will not see the recovery if people can't be confident that when they go back to restaurants, go back to movie theaters, go back to their jobs, that the government has successfully done what it said it was going to do. And so you end up with this slow rolling disaster, the same bad decision-making and fear and political cowardice that led us into our homes now is going to mean that the pain, the economic pain, continues far longer than it needed to.
So another confusing development over the weekend was the new CDC guidance that all Americans should wear cloth face masks when going out in public. Trump made this announcement at a briefing where he then said he wouldn't be wearing one himself because, quote, I just don't want to. According to the Washington Post, the guidelines were the result of a battle between the CDC and the White House. The White House folks were against it. The CDC was for it. Tommy, why do you think Trump and his political people aren't thrilled with this idea?
So like Lovett was saying, like, this is one of those issues where, like, I'm not as worked up about it. At the risk of sounding like Trump, like, I don't think it's the most important issue for all of us to be fighting about, right? Social distancing is the key, and I would love to have a bigger fight nationally about why some states aren't doing it. But, like, when it comes to masks, civilians shouldn't be using the N95 masks or even surgical masks. If you have to leave the house and go to the grocery store, the CDC is now saying maybe wear a cloth mask, which might help, especially if you are infected and you don't want to be, especially if you don't know you're infected, you don't want to be spraying more spit that has the virus in it on places and then inadvertently spread it. It's probably not going to do anything to protect you, the individual here. I'm guessing that, I don't know, there's probably two parts to this. Like, Trump probably he's vain. He doesn't want to look stupid by wearing a mask on TV because it'll mess up his hair or whatever. He's also just a petulant asshole in the face of any authority or common sense. I also suspect that he thinks the whole country wearing masks will make things look and feel worse and scarier for a lot of people. So there's probably a psychological element of this, but, like, I don't know, man. He just picks every fight.
Lovett, what did you think? I'm sort of with the last point that Tommy made, that he is anything that makes this, he's still in this fucking warped alternate reality where anything that makes this look serious or makes this seem scary, he wants to avoid, even if the science tells him otherwise.
Yeah, I mean, if Americans are walking around with masks, it means the virus won and beat him personally. It's a personal rebuke. Like, that's really what's in his mind. Now, I feel like there's some dissensus about the value of masks. I mean, the government has sent incredibly misleading signals for months now about when and where to wear masks. I think they were correctly worried that people would hoard masks, so they said you don't need masks, while probably knowing that on the whole, while it might not protect you from getting it from someone else, it might help other people, even if you have a cloth mask and not a medical mask. But and then there's some question about, like, well, if a bunch of people wear masks, will they think they're more protected than they are and put themselves at greater risk, right? There's sort of like unintended consequences, but that is not what Donald Trump cares about. Donald Trump is not going to Dr. Fauci and saying, I've looked at some of the data and in the crosstabs, it's pretty clear that there might be some countervening effects. No, he's like, it looks bad. It looks like I lost.
But it's just like, normal leaders just follow the science, right? The masks are not a cure-all. The masks should not take place of social distancing measures. But there's clearly been enough studies that show that if everyone wears masks and, a large percentage of people are asymptomatic who have it, and you're doing social distancing, but you're going to the grocery store and you have a mask on, then yes, there is, whether it's 10%, 20%, whatever percent less of a chance that you will transmit the virus. So take it, right? It's
right.
It's not a guarantee. It's not 70%. It's not 80%. But it's some small chance that you might reduce the risk of transmission. So we should do it, right? There should be no politics entering the consideration here. This is like with everything else, which is now what he is enthusiastic about that we saw yesterday is an anti-malaria drug called hydroxychloroquine that he pushed again at Sunday's briefing, despite the fact that doctors and health experts say that it hasn't yet been proven to work against coronavirus and that it may cause dangerous side effects. For example, after Trump said, "What do you have to lose by taking the drug?" the president of the American Medical Association said, "Your life." Why
Concise.
Why do you think he's pushing this drug so hard? Lovett, what do you think?
I don't think we know. We genuinely don't know. Like, there's a couple layers to this. One is he just wants to tout something. He's just going from news cycle to news cycle, and he wants to latch onto something because maybe it'll go goose the markets. Maybe it'll send a good signal that we're going to be able to get out of this thing and get him to the next briefing. There's a bunch of, people who circle him like Rudy Giuliani and Peter Navarro who are pushing this. We don't totally understand why. I don't know what Rudy Giuliani's personal financial interests are in this. Nobody does. Kind of feeding him bad information, which is also being spread on Fox News. Then part of it too is that there's a kind of remember in the financial crisis, like Goldman makes money whether you lose or not. Like, if it works, they're going to say, "See, I told the scientists. See, I told the doctor. See, I told the media." And if it doesn't, they'll just pretend it never happened and bounce on to the next thing. So they're just, it's a completely just unethical, chaotic, grabbing at something in the news and latching onto it without much of a real justification. That's it.
Tommy, what do you think?
It's so weird. It's so weird. Like, it's
weird.
So to Lovett's point, like the Washington Post reported that Rudy Giuliani has been pushing it and that he's getting his information from a right-wing doctor on Long Island who, according to the Washington Post, once pleaded guilty to conspiring to extort Steven Seagal. So that's all I know about that. I'm guessing he has a financial interest. He's a scumbag. Rudy Giuliani is a terrible person who gives awful advice that got Trump impeached. But hey, whatever. Do what you do. Axios
I have it on good authority from Joey Buttafuoco that this works.
Axios reported also that there was a big fight over the issue in a recent coronavirus task force meeting. And so, Fauci's in there, and he said this publicly that he believes there's only anecdotal evidence that this drug might work. Trump literally jumped in and took a question to prevent Fauci from talking about it at yesterday's White House briefing. But I guess in this Situation Room meeting, Peter Navarro, who is Trump's right-wing trade advisor, exploded on Fauci and was like dumping studies on the table that he had downloaded. And just remember, this is a guy who works in the White House because Jared Kushner like Googled how to learn about China and found his book on Amazon. So he has no medical expertise. So like initially when I started hearing everyone fighting about this, I was like, I don't get why he's fighting this battle. I don't know how hard to push back, because to Lovett's point, like if it ends up saving a bunch of people, he'll say, aha, I was right. I do worry about someone taking a drug that they weren't prescribed. That seems like it could lead to bad outcomes. I worry about a run-on supply for others who actually need the drug, but like I can't stop him from repeating his bullshit. But then I watched Sunday's task force briefing, and so much time was spent by like repeated individuals focusing on efforts to procure and distribute this drug to places. And I'm worried about how much time is being pissed away on hydroxy whatever versus like ventilators or N95 masks or all the things that we know could actually move the needle.
Or other treatments, right? I mean, Dan Diamond at Politico reported this a couple weeks ago, that there's a lot of government researchers who say that they are being pressured by Trump to chase down whether hydroxychloroquine works when there are a whole bunch of other antiviral treatments that may be promising, right? Like, if it works, that's great. We can all say, like, Trump was right the whole time. I don't give a shit. It saves a bunch of lives.
Yeah.
Great. Fine. Good for Donald Trump. But, like, again, just like the masks, let the fucking science dictate what treatments and cures and vaccines you pursue, not like Rudy Giuliani and a bunch of right-wing goons. And like, of course, I don't put it past any of them to have a financial motive here, but I don't even think they have to. Like, I think it is, everything we have seen so far points to one explanation, which is that Donald Trump wants an easy way out of this. He does not believe that we need to be sacrificing as a nation, that we need to have this like long period where we're all staying at home. Like, he wants out of this as fast as possible. He wants an easy way out. He's like the original fucking get rich quick guy, right? He's a salesman. He's a snake oil guy. Like, his whole life, he has believed that you can do something easy to get ahead, and believing that there's some treatment out there that all he has to do is just yell about at the briefing and that's going to fix everything fits perfectly in line with his worldview.
And also, like, the lack of expertise, like Donald Trump saying, what do we have to lose? Peter Navarro throwing down studies he doesn't understand on the table. There's a reason people like Fauci and other experts have caution in these moments, because they have a wealth of experience. And we don't. I don't know anything. I don't have a wealth of, we don't know about this, but we know that they're drawing on a lifetime of seeing potential medicines that ultimately don't work and do more harm than good, unintended side effects, unintended consequences of early pursuit of potential breakthroughs. Like, they're drawing on a history that teaches them to be cautious in the wake of potential medical treatments. And because people like Jared Kushner and Peter Navarro and Donald Trump have literally never thought about this stuff before in their entire lives, they're arguing. They're arguing for things they have no basis to argue for. That's all.
So, as part of Trump wanting an easy way out of this, he did a call with sports commissioners over the weekend and said that he wants the NFL season to start on time in September. Of course, governors of both parties have now said they don't expect to be filling up stadiums this fall in cities like LA and places like Ohio. Trump at the briefing on Sunday was still pushing for the country to open up soon, kept talking about that. How is this going to work out? How should this work out? Like, what is the most realistic path out of where we are now short of a vaccine, which scientists keep telling us is 12 to 18 months away. Tommy?
I mean, let's just start real quick. Let's just start with how Donald Trump spends his time. He does 2 hours of these briefings maybe every day. He makes his whole task force, who I'm sure are working 24/7, 7 days a week, stand there and just hurry up and wait. Like, that's hours of lost time they'll never get back. Doing a call with sports commissioners, like, yes, we'd all love to see sports start again. It would be a welcome distraction from this nightmare we're living in. But like, in terms of sequencing, giant events with huge crowds are probably going to be pretty far at the end of the list of things that are going to happen again. So it's just like, It's PR nonsense. So, if we had the ability to test people repeatedly and quickly, you could see a scenario where things start to slowly open back up in a controlled way. I mean, I saw footage of China today on CNN, literally of stores and markets that were completely closed down, that are now bustling with people. They're several months ahead of us. They were dealing with this horrible outbreak in January. Look, that decision could be a disaster if they are not careful. The 1918 flu was much worse when it came back after the summer for the second season. So we can't open up too quickly. I'm also really concerned about healthcare workers who, like, above all else, need a break. Like, that's why we're doing social distancing. Remember, it's not that, it's to make these hospitals not just be overrun with patients who can't seek treatment. And I'm like worried about these people hitting a breaking point. So I don't know that this could work right now. I think it's insane that we are in the same briefing. Trump is saying, like, there will be death. And then in the next breath, he says, we have to open our country again. We don't want to be doing this for months and months. We might have to do this for months and months. The mixed messages are driving me crazy.
Love it.
Trump thinks if there's no football in the fall, it will make men really mad at him.
Yeah. What African-American men will he yell at about kneeling? Right.
Right. It's, we only really get one shot to prove that our effort to control this the first time worked. We get one shot to come out in a way that is safe and based on science, that gives everybody the confidence that they can trust that it's safe to go to the movies, it's safe to go to a concert, it's safe to go to a football game, it's safe to go to the ballet or whatever's more popular. I don't know what's more popular, ballet or football, but like whatever the big things are. And Donald Trump doesn't care about that. He cares about November. Everything for him is now about November. He is seeing that the delays that led to, the 70 days of stupid that led to this moment are meaning that his fall, this key moment where he's going to campaign for re-election on an economic comeback, are maybe starting to go away, and he's panicked. He's panicked, and he doesn't know what to do. But the one thing he doesn't care about are the people that will be hurt and the pain that will be caused by too quickly coming out of this like stay-at-home effort.
When is the call with Blue Man Group or Cirque du Soleil or Lin-Manuel Miranda?
Yeah,
I'm upset.
Yeah.
I am
Apple Plus can't shoot their season 2, people.
This really worries me because, I'm concerned that we're going to make the same mistakes in not preparing for the fall that we made and not preparing for what we're dealing with right now. And, people like Scott Gottlieb, who is Trump's former FDA commissioner, people like Andy Slavitt, who worked in the Obama White House, like all of these healthcare experts, epidemiologists, are sort of coalescing around two things that we need to do right now to make sure that we can at least start opening the country back up. And Tommy, you mentioned that number one, the most important is testing, like fast, available, reliable testing all over the country, testing not just of symptomatic people, but asymptomatic people, and a surveillance system so that you know who's tested positive, who hasn't, where there might be outbreaks, so then you can have certain cities and states more open than others, and like it's going to have to be sort of a series of rolling shutdowns and opening the economy back up, and that's the best case scenario here. And then the other thing that we just mentioned is serious investment in treatments. If we can't get to a vaccine for 12 to 18 months, are there treatments that make the disease more manageable? And are we letting the scientists find out what those diseases are and pushing them just to discover whatever's out there as opposed to Donald Trump's favorite drug? And I don't see either the testing or the investment in finding the treatments ramped up like they should be right now. And every time I see one of these fucking briefings, I just want reporters to keep screaming at Donald Trump and the people up there until they get answers about the fall and what's going to happen with the fall. And Jake Tapper did a great job of doing this at the end of his show on Sunday, asking the president, where's the plan? What is the plan for the fall? Speaking of the fall, as you said, Tommy, a lot of experts believe that there's a potentially deadlier wave of the virus that comes in the fall. So it's even more outrageous that Donald Trump and a bunch of Republican politicians are now against making it physically safe to vote in the presidential election, either with universal vote by mail or more early voting or whatever. Politico reported on Friday that the president's reelection campaign and the RNC are gearing up for a massive legal fight in the months ahead to stop Democrats from trying to make voting safer and easier. And here's what New York absentee voter Donald Trump said about why he doesn't think others should have the same privilege. So I think this is very, very, very dangerous. What about you guys? What's your concern level here on voting? Tommy?
High. I mean, it's quite high. Look, it has been a Republican strategy for a long time to make it harder for people to vote, especially people of color, low-income people who have to work shift jobs. And this is an extension of an incredibly cynical strategy that is born of their coalition, older white people, dying off and refusing to change their platform that might bring in Latino voters, young people, others, right? So they are going to ride this strategy until the party no longer exists. And so, it's so cynical, it's hard to even believe that a party would push a strategy that might lead to people dying because they wanted to vote. But here we are. Mark Elias, who's an incredibly smart election lawyer, wrote a great piece about all the things that we should be doing. That includes making curbside voting available for everyone. A lot of disabled people now can drive up, get a ballot, fill it out, hand it off. We need to expand early voting, and that should include weekend voting for people who just can't get off work. We should adopt vote anywhere rules, which means you don't have to go to your location and hope to get a provisional ballot. If you go to the wrong polling location, you can vote anywhere. And then also we need to make vote by mail the standard across the country. That might take a little longer, but that has to include paying for postage, making sure that these signature matching laws that are being used to throw out tons of vote by mail applications or ballots aren't too onerous, et cetera, et cetera. But yeah, I mean, look, in 2018, 68% of poll workers were over 60 years old and more than a quarter were over 70. So that's an incredibly at-risk population that we're asking to make our elections happen. And that's unfair to them.
Lovett, it does seem that Democrats should be screaming about this and demand voting protections as part of the next coronavirus relief bill, right?
Yeah, yes. I mean, look, we were heading towards a November election that everyone anticipated to be the biggest turnout in history, right? There's the turnout. The turnout's going to be incredible. The Republicans are going to turn out. The Democrats are going to turn out. We have an election in Wisconsin that's in chaos right now. Absolute chaos, right? And why is it in chaos? You can point to the efforts of Republicans to prevent people from voting for a long time that have continued now in a kind of truly nefarious way. But underneath that, it's pretty simple. There's two things going on at once. You need to stay home to stay safe, and you need to leave your house to vote. They have put those two things on at the same time. Both of those things are true, and they conflict, and it's created chaos. And that's exactly what we will head to in November. We need more vote by mail. They say that there's fraud. There's only been one big case of vote by mail fraud in recent years. It was a Republican scam in North Carolina. That's it. That's the example. It was Republicans trying to steal an election. So if we don't want to wake up on Wednesday, November 4th, to the chaos of an election that didn't work on a grand scale like what we're seeing in Wisconsin, we have to act now. We have to make it so that, yes, there's more vote by mail, there's more voting sites, there's more options, there's more ways to vote early, and we need to give states the money and the resources to put those things in place right now, or we are going to head towards like a potential illegitimate election that we've just not seen. I mean, it's a truly terrifying outcome.
Yeah, I mean, I see a lot of people talk about what are we going to do if Donald Trump cancels the election, if Donald Trump postpones the election? First of all, he can't do that. Only Congress can do that. But there's an equally terrifying and probably more likely scenario here, which is that the virus comes back in the fall. Donald Trump decides to downplay it like he did in the first place. He says it's nothing but a liberal hoax because they're losing the election. And he tells his supporters, Go out and vote anyway. It's going to be fine. Meanwhile, all the Democratic supporters and the Democratic nominee and Democratic governors and mayors are saying, it is dangerous. It's dangerous to vote. We want to do mail-in, but in some states we can't do mail-in because these Republican legislatures and Republican governors are refusing to do this. And so then you have Donald Trump and his supporters feeling like they can go to the polls because their president told them to, and our supporters terrified to choose between the virus and voting.
And by the way, where are the lines? Where are the lines now? Right. When there's a big crowded polling place, where are the lines? They're not in the rural white neighborhoods. They are in the urban areas, they are in black areas, they are in Hispanic areas, they are in poor areas. That is where we have seen these big crowded places. Now imagine what it looks like if the government is telling people they must remain 6 feet apart, and a lot of senior citizen poll workers have decided to stay home. The night, like, it's a truly just, it is a predictable disaster. It is a predictable catastrophe.
I have to say, I mean, Republicans, this has been a Republican strategy for a long time, and the debate usually ends up being voter fraud versus voter access. And I don't think that Democrats have always done well in terms of making the case and fighting for this. I do think, as cynical and disgusting as it is, it provides us an opportunity to say the Republican Party wants to make voting dangerous to your health. The Democratic Party wants to do all these things to make sure that you can vote without getting sick. I suspect that is a message that will cut across all party lines, especially for people over, let's say, 60.
I mean, a Republican operative is quoted as saying, there's a major feeling that absentee and early voting are tools of the left to make up for the fact that they can't win on election day. Like, think about that voting safely is a tool of the left now. Early voting is a tool of the left, making it easier and safer for Americans to vote is now a partisan issue, and it's a tool of the left. Fuck these people forever. It is like, it is very, I think the Democrats, like, whatever is in this next bill, and Mitch McConnell's going to scream about it, and Donald Trump's going to scream about it, and a whole bunch of Republican senators are going to scream about it. And if they have to hold up the relief bill for this, I think they have to. It is, there is stopping the spread of the virus, there is fixing this economy and this economic disaster, and then there is protecting our democracy. I just don't see anything more important than that right now.
I agree.
All right.
Yep.
Some breaking news right before we go to Elizabeth Warren is Tony Evers, the governor of Wisconsin, just issued an emergency order shutting down Tuesday's election and delaying it until June 9th, which is good for him, but wild because he called the Republican legislature into session this weekend so they could do it because he thought that they would have to do it. They refused, and now he's doing it himself. That's going to be interesting in Wisconsin, but I'm glad he did it.
I'm glad he did it too, but there's so much punting of hard choices happening right now. Like, we're going to vote on June 9th. Are you fucking kidding me? We're going to gather in a gigantic convention in mid-August. Are you insane? None of these things are going to happen. Football's not going to start on September 9th. Maybe I'm wrong. I pray to God I'm wrong. But I do think the entire political establishment, it would be nice if people were preparing us for how long this could be, because at least then you could wrap your brain around it. Now it's just these delays, and people are going to feel frustrated and say, "I thought we were going to have a convention." Blah blah blah. It's just
so I'm with you on the convention and the football. I think that on this, it's not about, or it may not be about, let's all then gather in June. But now they have more time to do mail-in voting, to send out more absentee ballots for people to get the absentee ballots back in time.
Do all of that.
And potentially they can do more early voting where they if you have 3 weeks, you can say, all right, 10 people at a location, you go in one at a time, whatever. But
you can make appointments. You can make appointments to vote. That's one of the other things Mark Elias talked about. We should be able to make appointments to vote.
So by June, that might be possible. But certainly what you're saying, Tommy, it would not be possible to just
probably not with this Wisconsin legislature, if we're being honest. But hope springs eternal.
All right. When we come back, I will be chatting with Senator Elizabeth Warren. Thanks to Senator Warren for joining us today. Good to see you guys as always.
Good to see you.
We just we like staying on this Zoom just to have human interaction.
It's raining so hard I was worried you could hear it. Oh, go ahead. Sorry.
So I ordered delivery barbecue, for dinner.
From where?
Which barbecue?
Blood's House.
Yes.
Love Blood's House.
And then on Sunday morning, there was a little extra brisket. So I chopped it up and I mixed it with eggs. And then I had leftover tortilla chips that were about to go bad. And I made egg brisket nachos. And I had an avocado. Mixed that up. I made guacamole. That's just something that happened on Sunday.
That sounds amazing.
Tommy, you want to talk
Vinny's
about something you
takeout
did
on
with the
Saturday.
slow cooker?
No, I didn't really cook that much this weekend, John, but thanks for asking. We did John and Vinny's takeout on Saturday, and Friday night we did Night and Market, which, if you're ever in Los Angeles, those are two phenomenal places. John and Vinny's is Italian, Night and Market is sort of like Thai. It's just amazing food.
We did the counter in Santa Monica, also great. Just trying to shout out local businesses here, which local restaurants, which are important to keep frequenting. And then Emily made a fantastic steak dinner last night. So
Nice. Yeah, I went to the grocery store on Sunday and was thrilled to do my prep for the pod after, where I saw Dr. Burke said, don't go to the grocery store this weekend, which was cool of her just to slip in there on a fucking Saturday briefing. But, we'll see.
Oh, always comforting information coming from the White House. All right, everyone. We'll talk to you later. Bye.